Today I talked about on a panel, Racism, a Global View, and I talked about the importance of using international human rights law to combat racism and why it's an important complement to domestic civil rights law in the United States. And the two together we can use to combat health disparities. Because we have racist disparities in the health system, in health outcomes, and they're important to everybody who is part of the public health community. So we need to use all the tools that are available to us to fight them.
So today I talked about racism, anti-racism and health from a Aotearoa New Zealand context. I think it's important to have a global perspective on racism because it really is a global health issue, and so having a panel like today's panel allows us to learn from other contexts and think about ways we can work together as a global public health community to combat racism.
Today I was in a main session, President session. We talked about racism in a global perspective. I'm from Brazil, I'm a Brazilian activist, and I bring here some information how we managed to have a national black population health policy. I brought the information about how it was a social movement action and how we put the international agenda, mainly the Third World Conference on Racism, how we use this as an opportunity to pass many different laws and mechanisms inside Brazil.
Racism is a huge part of what's happening in our world and society, in the healthcare system, so we should talk about it.